Have you ever wondered what could happen to your penis if you don't have sex for a long time? Picture this. You wake up one day and something feels off. Your once vibrant and responsive member seems lifeless, as if it's given up on you. Is it possible that prolonged sexual inactivity could lead to permanent damage or even erectile dysfunction? Could your penis actually shrink? Could you lose the ability to perform altogether? Before you panic, you need to hear this. But first, make sure to like the video and subscribe to our channel to stay informed about all things health and wellness.
If you love this video, just say you love it. And if you don't, tell us in the comments so we prepare a better video for you. Don't forget to share this with your partner as a reminder to them.
Number 1. Erectile dysfunction (ED). Prolonged periods of sexual inactivity can potentially lead to erectile dysfunction. The saying "use it or lose it" holds some truth here. Without regular sexual activity, the penile tissues may not receive adequate blood flow, leading to weakened erectile function. Erections are crucial for keeping the penile tissue healthy, as they bring oxygen-rich blood to the area, which nourishes and maintains its elasticity. Over time, the lack of erections can cause the smooth muscle and tissue within the penis to lose some of their function. When this happens, the ability to achieve and maintain an erection can become compromised. This is particularly alarming for men who might already be on the edge of developing ED due to other risk factors such as age, smoking, or underlying health conditions like diabetes and hypertension. The psychological impact of experiencing ED can be profound, often leading to anxiety, lowered self-esteem, and a reluctance to seek intimate relationships. Essentially, avoiding sexual activity for too long can set off a chain reaction that not only affects your physical health but also your mental well-being. Number 2. Penile shrinkage. Believe it or not, your penis could actually shrink due to disuse. This phenomenon, known as disuse atrophy, can be particularly concerning. Without regular erections to stretch and stimulate the penile tissue, the cells can begin to atrophy, causing the penis to lose some of its length and girth. This process is more pronounced in older men, as the natural elasticity of penile tissue decreases with age. The reduction in size isn't just a cosmetic issue, it can also affect your sexual performance and satisfaction. The fibrous tissues that replace the elastic ones make the penis less flexible, which can lead to discomfort or even pain during erections. Regular erections, whether through sexual activity or masturbation, act like a workout for your penis, keeping the tissue healthy and preventing shrinkage. Without this regular exercise, the penile tissue can become more rigid and less capable of expanding to its full potential during an erection. Additionally, the psychological impact of penile shrinkage can be significant. Men often tie their sense of masculinity and confidence to their sexual performance and physical attributes, and noticing a reduction in size can lead to severe anxiety and depression. Therefore, maintaining regular sexual activity is crucial not only for the physical health of your penis, but also for your overall mental well-being. Number 3. Reduced libido. The less you have sex, the less you may want it. A drop in sexual activity can lead to a decrease in libido. Your body and brain may start to adapt to the lower levels of sexual arousal and interest, making it harder to get back into the swing of things when you do decide to engage in sexual activity again. This decline in libido can be attributed to several factors, including hormonal changes. Regular sexual activity helps maintain healthy levels of testosterone, the primary male sex hormone responsible for libido. Without regular sexual engagement, testosterone levels can drop, leading to a decreased interest in sex. Additionally, the brain plays a significant role in sexual desire. Regular sexual activity stimulates the release of neurochemicals like dopamine, which are associated with pleasure and motivation. When these neurochemical pathways aren't regularly activated, your brain might start to deprioritize sexual activity, leading to a lower overall interest in sex. This reduction in libido can become a self-perpetuating cycle. The less you engage in sexual activity, the less you desire it, which further decreases your likelihood of having sex. This cycle can be challenging to break and can have far-reaching effects on your relationships and self-esteem. It's crucial to recognize that libido is like any other aspect of health. It needs regular attention and care to remain vibrant and active. Number 4. Mental health impact. Sexual activity is linked to the release of hormones like oxytocin and endorphins, which promote feelings of happiness and relaxation. A long period without sex can lead to increased stress, anxiety, and even depression, This, in turn, can further impact your sexual performance, creating a vicious cycle of sexual and mental health issues. Sexual activity is a natural and effective way to release built-up tension and stress. The physical exertion, coupled with the emotional intimacy, helps to lower cortisol levels, the hormone associated with stress. Without this regular release, stress can accumulate, leading to chronic anxiety and depression. Additionally, sexual activity fosters a sense of connection and intimacy with your partner, which is crucial for emotional health. The absence of this connection can lead to feelings of isolation and loneliness, further exacerbating mental health issues. Moreover, the psychological impact of not engaging in sexual activity can lead to increased performance anxiety. Men who go long periods without sex might start to worry about their ability to perform, which can create a mental barrier when they finally do have the opportunity. This anxiety can manifest physically, leading to difficulties in achieving or maintaining an erection, thereby feeding into the cycle of ED and further mental health struggles. It's important to address these issues proactively, whether through regular sexual activity, therapy, or other stress relief methods, to maintain both your mental and sexual health. Number 5. Prostate health. Regular ejaculation is believed to play a role in maintaining prostate health. Some studies suggest that men who ejaculate more frequently may have a lower risk of developing prostate cancer. Thus, a prolonged absence of sexual activity might potentially increase the risk of prostate-related issues. The prostate gland produces seminal fluid, and regular ejaculation helps to flush out this fluid, keeping the gland healthy and functioning properly. Without regular ejaculation, the seminal fluid can accumulate and stagnate, potentially leading to inflammation or other prostate issues. Additionally, the act of ejaculation helps to clear out any potential carcinogens that might have accumulated in the prostate. Men who ejaculate frequently, whether through sex or masturbation, seem to have a lower incidence of prostate cancer, possibly due to this regular cleansing process. Moreover, the prostate plays a crucial role in the overall reproductive system, and its health is intimately tied to sexual function. Prostate issues can lead to discomfort, pain during urination, and sexual dysfunction, all of which can severely impact your quality of life. Maintaining regular sexual activity, therefore, is not just about pleasure. It has significant implications for your long-term health. Ensuring that your prostate remains healthy through regular ejaculation is a simple yet effective way to reduce the risk of more serious health issues down the line. In conclusion, long-term sexual inactivity can lead to various physical and mental health issues. Regular sexual activity or stimulation is essential for maintaining your overall well-being. Don't let inactivity harm your sexual health. Like the video and subscribe to our channel for more health insights and tips.
Trying me, ain't no hide and seek, I hide to be far from anxiety. I need my space, I need my privacy, I need some silence, please. You're all too loud, you don't speak quietly. Opinions violently thrown across every surface, it makes me nervous. Is the world honestly burning? That's all I'm learning. Hope that we can make a turn and start reversing all our minds and put the work in. We got some work,